Very good day for everyone. This is Safaa Osman from University Technologi, Malaysia, and I want to present my paper with the title of Patient Management System in the Emergency Department during COVID-19 pandemic by using technology of I.R 4.0. So first of all, I want to start with a brief introduction. As we know, middle and low-income countries are suffering from inadequate resources in their emergency departments and also for lack of staff support, and there is a large number of patients who is coming and visiting the emergency departments daily. These limited resources lead to overcrowding, and patients may waiting for a long time, and they may get a wrong triage and wrong diagnosis, and it leads to low accuracy of treatment and eventually for high mortality. The common patient conditions that visiting the emergency department are car accidents, acute abdominal pain, and bone fracture. For acute abdominal pain patients, the previous data shows that a large number of acute abdominal pain diagnosis is missed during emergency department visit, and this is because the limit of resources. And also another problem is the current COVID-19 pandemic. The emergency departments are planning to reduce the spread of the infection while maintaining a reasonable patient flow. For this reason, we proposed a new model of patient management that focuses on patients with acute abdominal pain in the low and middle income countries emergency department. This model will improve patients' flow by predicting the disease path and steps in the emergency department, as well as predicting the risk score of the conditions, and this can lead to reduce the overcrowding and also to enhance the accuracy of the diagnosis. Also, the model with seamless information transfer between the emergency department staff. So the methodology of this proposed model designed in the 5 aspects. The first one is the registration and triage, and the second one is COVID-19 assessment and medical data entry. And the fourth one is prediction, disease steps, and risk calculation. And the last one is safety and security aspect. I'm going to go through them one by one. So the first one is the registration and triage. So as we know, registration is the initial step in the emergency department, which is critical process that that must be a precise patient identification to ensure that the data collected is linked to the relevant person. So for that, we use QR code technology. Then the patient, when arrived to emergency department, they receive a QR code bracelet or tag. Also, the model includes measures of vital signs, which is very crucial for the triage process, and it will be done by using smart sensors. The second aspect is the COVID-19 assessment. So according to WHO, each patient or each person before entering to the emergency department or to the hospital must undergo for COVID-19 assessment, and the practitioner in the entrance can be decide which person need to quarantine and which are not needing for quarantine. And this algorithm and to decide quarantine for patients is getting from according to CDC or a control disease center of disease control, sorry. The third aspect is the medical data entry. There's different types of data that very important in the process of diagnosis and treatment, like patient's general information and medical history, and this can be taken by ED practitioner or patient's family through user-friendly interface, and also the vital signs, which may be very important to monitor in real time, and this will be taken by smart sensors and Internet of Things technologies. And the lab results and medical images by utilizing QR code, these results will be transferred immediately to the computing cloud and then to the system. The fourth aspect is the prediction, disease steps, and risk calculation. Any abdominal pain or any disease condition can be caused by a combination of variables, which we called it as risk factors. Like we see here, this is some example of the risk factors of gastrointestinal constipation and also some of risk factors of the appendicitis. So these risk factors can be linked together to indicate and predict the disease presence. The methods here will be based on gathering this data from previous patients with these diseases, and then this data will send to the unsupervised machine learning algorithm, which will calculate the weightage for each factor. Then the system using the patient's data to calculate the risk score of each possible disease. Based on the missing data for the most likely disease, the system will also anticipate the necessary examination that must be to do. So the system can be predict the next steps. The last aspect is the safety and security. So the system will be built to integrate with to interact with HL7 interface and security services provided from cloud providers and also the HIPAA protocols. To examine or to evaluate this model in order to know if it can be usable by doctors or not, we made a survey and asked 22 doctors from different specializations about their perspectives of this model. So their thoughts or their results are 19 out of 22 believes that abdominal diseases are the most difficult disease in diagnosing, and the procedures that used to treat them now have a high mistake rate. 95.5% or 21 out of 22 believes that QR code technologies will improve patient identification accuracy and eliminate errors. And also 20 out of 22 believes in the accuracy of smart sensor for measuring and monitoring vital signs. 7 out of 22 agree to employing smart sensors may be inconvenient for patients. They think that smart sensor may be inconvenient for some patients. And 6 out of 22, they think or they believe that doctors should not rely on the clinical assessment completed by the nurses and entered into the system, but instead the doctor should re-examine patients. 21 out of 22 they believe that the adoption of such a system can help and facilitate the process of diagnosing the disease, but they agreed that any decision should be taken based on the approval of the doctor. 50% of the participants do not have complete faith in artificial intelligence algorithm for disease diagnosis and prediction, and 22 out of 22, which is mean 100%, sorry for the mistake, they think that this approach will save time and effort. And 3 out of 22 consider that the main role of the doctor will be abolished in the future if we adopted these models. 100% of the participants think that implementing such a system can help to reduce COVID-19 spread inside emergency department because it's minimizing patient interaction and shortening their stay in the hospitals. And 19 out of 22, they think that the system is able to suggest appropriate medical imaging methods to accurately diagnose the disease and reduce expensive and unnecessary examination in most cases. And 5 out of 22 think that the system will not be accurate or simple to use for managing large number of patients. So in discussion, as we see in the result, half of the respondents do not agree with using artificial intelligence technologies in diagnosis and predicting treatment steps, and they believe it's untrustworthy. And in my point of view, I think because a large number of people do not know how actually artificial intelligence is working, and they didn't know the high accuracy of result it can get. Participant doctors believe that possible errors in the diagnosis of abdominal diseases are usually due to first, because diagnosis is often done by doctors with little experience, The second, because some examination and medical lab technologies are frequently expensive and or unavailable in low and medical income countries. The third reason, because sometimes patients take inappropriate medicines before consulting or seeing doctors. In general, most of the participants have a positive perceptions about the model, and this because the model has different pros, like it can managing patients electronically, which can contribute to a reduction in the development of COVID-19. Also, the hospital can save money of administrative and labor expenditure by using these technologies, and also by employing a cloud computing server, it can become the ability to monitor, store, and access patient electronic health records at any location in the hospital more successful, and this will increase the seamless of information transfer between the staff. On the other hand, the model has different cons, like by using these technologies, the annual cost will be rises, which forces people to pay more in order to using these technologies. And also, as we know, healthcare is one of the most targeted businesses in the world, so more cyber threats can be faced. So that hospitals must build a very strong security systems. In conclusion, in order to address the issues that arise in most low and middle income countries, patient management model is proposed. This system will use various artificial intelligence algorithms, IoT, smart sensor, and cloud computing to provide high accuracy disease prediction, and also eliminate unnecessary imaging examination to diagnosis of acute abdominal pain, and also to promote patient and staff satisfaction. The model allows for seamless information exchange while avoiding direct communication amongst emergency department staff, which can reduce the spread of the COVID-19. And thank you for listening.